Thank you, Tlaga. I see there's Nokia C1 who is trying to connect. If maybe Nokia C1 could just log on with a name so that we are able to refer to her as...
We are live, speaker.
We are live.
Yes.
Okay, thank you very much, Dr. Nyati. Thank you very much. We are starting with our show. Good evening, Joburgers. Welcome to another installment of the show with myself, the Speaker of Council. As Dr. Nyati has said, we are live on various platforms, such as the City of Joburg social media platforms, as well as my own page, which is Nongaba Mulwele on Facebook, and at speaker_COJ on Twitter. We are also live today, and I'm very excited to announce this to our viewers, that we are also live on Jozi FM until 7 p.m., following which we will then take the stream and play it on Eldos FM from 8 to 9 p.m. We are very excited as this is the first time that we are conducting the show in this manner. So we have graduated in this year, 2021. Because once the show started online in March 2020 under the hard lockdown, we realized that there was a need to extend ourselves beyond the online or digital platforms and to get onto community-based platforms, starting with community media, because our intention is to talk to all our communities. Hence this new but very exciting partnership with stakeholders such as yourselves and Dr. Colin Hans and Eldos FM. On that note, ladies and gentlemen, our viewers, please receive a very warm greetings to my co-host for the first segment, Mr. Colin Hans. Greetings to all the listeners, all our viewers, our panel of experts, Professor Marwala, Pastor Abel, Dr. Sinabe, our civic education partner, Dr. Nyati, the leadership present on the platform, and all officials. Once again, the Talk with the Speaker of Council is a platform that allows for the civic to be educated on many issues that relate to local government in general, and the city of Johannesburg in particular. But we also strive to talk about matters that are of public interest to our local residents. Tonight, we are talking about COVID-19 pandemic. We are talking about vaccine truths and myths. Most of us will already know that the first batch of vaccination arrived on Monday. We are very excited, and thank you to our government. This is the first consignment consisting of 1 million doses of what we now know as the COVID vaccine produced by the Serum Institute in India. The vaccine is developed by a pharmaceutical company called AstraZeneca, together with the University of Oxford. Once testing has been completed, this batch is going to be issued to frontline workers, particularly if the healthcare sector. Once all of these developments are taking place, however, there's a lot happening in the backdrop, particularly as it relates to public sentiment in the South African context. I think we are all aware of that. South Africans are skeptical about the vaccine. The country is literally divided into two. Those are for and those against vaccine. A poll survey conducted by a data company called Ipsos indicates that by mid-December, 47% of South Africans said they would refuse a coronavirus jab. It indicates that citizens are concerned about the vaccine's side effects. They are concerned about the efficacy of the vaccine and are against vaccines in general, hence the rejection of this idea. So today, Dr. Senabe, who is Chief Director of Human Resources Development and Employee Health and Wellness at Gauteng Department of Health, is going to help us, abo laymen, understand COVID-19, the virus, and the vaccination process. He will take us through how the virus operates in the body, the concept of vaccination, why is it important to vaccinate? What are the rights of the citizens as it relates to taking the vaccine, and perhaps also take to the rollout plan of a vaccine in Gauteng. Welcome, Dr. Senabe, and thank you very much for joining us this evening. We really appreciate your presence. But ladies and gentlemen, there is more to our people not wanting ukuthatha a vaccine. That does not only include side effects. There is also another issue around the lack of confidence in the vaccine itself, and that is some do not trust the vaccine based on the view or a belief that the pandemic in and on itself is man-made, with the objective of wanting to control a new world order. I think we've heard that many times from different people. This is where the issue of 5G comes in. There have been so many theories and conspiracies about how the rollout of 5G technology is to blame for coronavirus. Well, as part of our panel, we have invited Professor Prof. Chilidzi Marwala, who is the Vice Chancellor at the University of Johannesburg and also the Deputy Chairperson of the 4IR Committee in the Presidency. Uzosirhabulisa nge-5G. Welcome, Professor Marwala, and thank you for joining us this evening. We are also joined by Pastor Abel Mahachi, who represents a faith-based organization in Johannesburg, to also share some of the challenges that they face as the faith fraternity, and also share his view on the 5G and e-vaccine. Welcome, Pastor Mahachi, and thank you so much for joining us. We really appreciate your time. We have our resident doctor on the show, who need no introduction, Dr. Nyati, who is our partner in our civic education in the legislature. Dr. Nyati has been doing some very powerful work around COVID-19, and we saw him even on the arrival of the vaccine. He was on television talking about the vaccine, and I wish to take this opportunity to also welcome him on the show. Welcome, Doc. As I said, ladies and gentlemen, our viewers, tonight we will do things slightly differently because we are live on Jozi FM. I think you have already heard Ntate Colin Hans already. Therefore, I am co-anchoring with Ntate Colin Hans in this segment. Each of our guest speakers will be allocated a few minutes to do an opening statement on some of the issues that I have already raised in the opening, following by an in-depth interaction thereafter. Without further ado, Kinela Marapo Ntate Colin Hans.
Please unmute, speaker.
Oh, I was saying Ntate Hans is muted. If he could unmute.
There we go. Thank you so much, and welcome to the show. And certainly this gives me an avalanche and the most inestimable pleasure for me to be part and parcel of this wonderful setup of great experts to come and deliberate on the issue the Speaker of Council has just alluded to. The speaker is joined by Dr. Sipho Sinabe as she introduced the panel. And without further ado, maybe because of time constraints, I should get straight into the whole matter. The first batch of the 1 million COVID-19 vaccines from India was delivered to South Africa this week. What does this mean for the country? And maybe we can start with you, speaker, and hear the sentiments of the other panelists.
Okay, ke a leboga ntate Hans. Like ke tshilo gore nna I'm representing laymen. According to me, I think since the beginning of the pandemic, there has been a lot of anxiety, a lot of fear of getting the disease, and also a lot of fear of death. And also, as a country, we have lost a lot of loved ones due to the pandemic. So for now, the arrival of the vaccine, I think, is a sigh of relief that at least we are going to vaccinate. Hans, when I was young, I still have marks of the vaccination in for different diseases, for polio, for flu, for anything. And even now, we do take flu vaccine before winter begins, and really it saves us from catching flu. So for now, I think it is a sigh of relief for the country and for the citizens. And I can't wait for my category to get vaccine. Thank you very much.
There's another question that has been doctors, is the Dr. Sipho Sinabe. What is the truth about the vaccines and how should they be viewed by ordinary South Africans? Maybe that can also go to Dr. Fundile Nyati.
Thank you very much.
Sorry.
Thank you very much, Chairperson, and thank you to fellow panelists and the citizens of Johannesburg. The vaccines that, as we have been told that they have arrived in our country, are supposed to ensure that we have immunity among ourselves as health workers first, so that when we are immune, we will be able to have a health system that is secured. That will be very important for us to get into our hospitals and clinics, taking care of our doctors and nurses who are unlikely to have infections related to COVID. So the vaccines are going to help us to ensure that we get individual immunity among the community of health workers. Secondly, the vaccines are also going to make sure that those of us, as the speaker had said, in her introduction, she was concerned about disease and death. So the vaccines are going to make sure that those of us who are sickly, who are above 60, those with hypertension and diabetes, that if we get vaccinated, then our chances of getting disease and of dying are actually reduced. And then why these people? It is this group of people who have 80% of the burden of the disease. So the people who are dying are the people who have uncontrolled hypertension, diabetes, and they get to our hospitals. So if they are going to be immunized, then our hospitals will be free of the burden of accepting them into the hospitals, and they will only come for their normal BP checkup and hypertension and diabetes and so on, not to die because of COVID and so on. The last thing that the vaccines are going to do is what the president has been saying is herd immunity, what he prefers to call it population immunity. So it is when we as a whole community of people in Johannesburg and the whole country are immune. And it is not when all of us are vaccinated completely, though we want to encourage everybody to be vaccinated. When 67% of us are vaccinated, then we can as a population say, "Singobile COVID," because it will not be, harming us as a population. At the end, we will have a good health system with doctors who are not infected and nurses who are not infected. We will have a good economy because those who are workers can go back to work, and they can be able to, with the speaker, grow the economy of Johannesburg so that we are economically a very strong nation. So that is what vaccines are going to do. But to summarize it, it is individual immunity of our workers. It is herd immunity or population immunity at a population level, so that we can be able to live freely with a clean health, a strong health system and a strong economy and herd immunity in our population. Thank you.
Dr. Nyati, you surely are sharing the same sentiments?
Yes, I think just to add there, at this moment, since we got to know about this pandemic, we know that there is no cure. Now, if there is no cure, the only thing one can do is to make sure then that people are given immunity artificially, so that should they be exposed to the germ, they already have got soldiers that are ready to destroy the germ at first sight. So basically, that's what we want all South Africans to be able to do. But obviously, it is not forced, so it is up to everybody's, conscience and decision. But basically, what we want is to make sure that South Africans no longer have to worry about getting sick from COVID-19 with a risk of them dying.
Let me bring in Professor Marala, and I'm bringing you on this point. What is the connection between COVID-19 vaccines and the 5G connectivity? We even heard reports some 5G infrastructure being vandalized in some parts of the country. Professor Marala?
No, thank you very much. Maybe if I could just emphasize the point that has been made, that vaccination is important, because it is only through vaccination that we are going to deal with this matter. But what we also have to bear in mind is that vaccination has a shelf life. So if we do not vaccinate fast enough, after 8 months, people will obviously be requiring further vaccination because it has a shelf life. So as we plan, we have to have good mathematical models to make sure that it does not become a fruitless exercise. Now, when it comes to issues of 5G, 5G is electromagnetic waves. Electromagnetic waves are basically the forces that unify electricity and magnetic forces. Whenever you see electricity, there is a magnet responsible for generating that electricity. And whenever you see electricity, whether it is cables that run over our houses, they are concentric circles of magnetic forces around. So that is a wave. Now, COVID-19 is a virus. A virus is a biological organism. It is alive and it dies if it does not find a host. So that is why we are told that on a hard surface, COVID-19 dies after 3 days. So this is a living organism. There is absolutely no link between 5G and COVID-19. The reason why people are making this link is because it turns out that when COVID came about in 2019, it was also the year in which 5G was launched. So people are thinking because 5G was launched in 2019 and COVID came to the world in 2019, that there's a causal relationship between the two. There is no causal relationship between the two. It's correlation. In statistics, when we study, we are told that correlation does not mean causation. For example, we know that during summer, more people buy ice cream, but also more people drown in swimming pools. It does not mean that ice cream causes swimming pool drownings. No, it's just that they are correlated. They are correlated because when it is hot, people want ice cream, but they also go and swim. So there is absolutely no link between the two. Thank you.
Now, let's bring the religious aspect into the whole matter. Pastor Abel Mahachi surely can do the remark first, but also let's look at the other chunk of conspiracies that comes from the religious context. There's a conspiracy theory that the Bible says the 666 in the book of Revelation. I mean, let's allay the fears. Come in, Pastor Abel Mahachi.
Yes, this conspiracy theories that we're experiencing now is based on twofold elements. The first element is biblical interpretation of texts. When you misinterpret texts in the Bible, you tend to come up with conspiracy theories. So hence, why we're experiencing this great division, especially in the sector, is because number one, people are interpreting text in the wrong way. For example, the 666 element, where we got half of, or probably majority of religious leaders believing that when you receive vaccine, you receive the 666. And the other leg of the religious sector saying, no, 5G is basically connectivity. That is the first element, misinterpretation of scriptures. And the second element is knowledge. There's a guy in the Bible called Hosea. God speaks to him and God says to him, my people perish because of lack of knowledge. So I'm glad that we have doctors and academics in our midst because they are able to articulate to us what is 5G, what is COVID-19, is there correlation between these two variables? Hence, it is important thereby after this that religious leaders need to be educated on the elements of 5G, COVID-19, as well as vaccination. If religious leaders are not educated, hence followers who run the race or the course of what their bishops and pastors are saying in relation to 5G and COVID-19. And secondly, it's also important that there must be a rollout as well of materials to various leaders and church leaders and also members as well, so that they understand that when we talk about 5G, what is 5G? When we talk about COVID-19, what is COVID-19? What is the importance of vaccination? Once we demystify our congregants, once we demystify these theories in the hearts and the lives of our religious leaders, hence we can rise up healthy communities. We have the right knowledge so as to emancipate our communities in that regard.
Now, this may go to any panelist, but then we know for the fact that we need to act very positive as far as encouraging communities to vaccinate amid the fake news and disinformation circulating, which confuses our people. Now, one has to find out, I mean, do we blame the environment on the ground if necessary messages were not coming through the right way? I mean, speculations were there before. And maybe we should have been proactive from government's position, from academia, because of academics in this country has got the responsibility not to come in as crisis managers. Do you concur? Any one of the panelists can come through, then we'll share the remarks as we're looking at time.
Maybe I can come in. I think we can do more. And what does not help is that you have had celebrities actually pushing for these conspiracies. And this probably is going to make some people reluctant to take vaccines. My mother also called me and she was talking about Bill Gates and vaccines. I have to put it forward that vaccination is not new, as Madam Speaker has already indicated. We were all vaccinated. TB vaccinations used to happen at school. And somebody will come to school and they will vaccinate you. Polio vaccination has done wonders. That is why now you have very few people who are having disabilities that are caused by polio. So yes, we could have done more and we should do more and encourage all our people to make themselves available for vaccination.
I also see Balkan Mufumadi, maybe in all honesty, as part of the panel. Your remark, if you're there, or maybe you're just a participant. Just want to check if Balkan Mufumadi is part and parcel of the panel. And the remark, please, if it's possible. Or we can continue taking any of the responses from the panel.
From my perspective, we have a challenge as a nation, and this challenge needs us as leaders to rise. The rise of our leaders, both on religious element and political leaders and social leaders, coming together and try and work together to see how we can roll out the process of vaccinations in our communities. It is through this unity that we'll be able to lead the nation the right path and lead our communities in the right place. It's not a time for us to score on goals, but a time for us to come together, the pastors, the politicians. It's not a time for us to march against each other's, point fingers at each other, but time to unite together. So my call as a pastor in our generation is, let's come together. Let's not fight, but let's come together and see how we can bring the country to a better, greener pasture than where we are today. That is my point. My call is a call of unity, of coming together as a nation. Thank you.
Dr. Nyati?
Well, thank you very much. I think, one can always say more could be done in the area of public health, education. Obviously, there's different players that can do that at a provincial government level, national government level, at a city level, and also individual professionals like us. We have not done enough. We have a duty to educate, to sensitize, our people. Now, where there is a vacuum, life does not allow for a vacuum. Others will will come into that vacuum and try and do things that are not right, what we call disinformation, giving information with intentions to mislead people or to suit certain agendas. So what I'm trying to say is that it's not late for us to do more within our abilities, to be there to answer questions, so that people know what is right and what is not right, and allow them then to make decisions about the information, and make sure that you use information from credible sources, not just from WhatsApp that is circulating, in our social media platforms. So let's use credible sources, NICD, National Department of Health, WHO, CDC, those kind of, sources, or qualified people, because if they mislead, then they can be reported to the professional council. Although some of the spreaders of conspiracy theories are doctors like me, and those must be reported, and there are regulations as part of this Disaster Management Act that were, issued around beginning of April, that anybody who, is involved in conspiracy theories or disseminating that information can be charged. So let's start to report to law enforcement authorities, those people who are spreading disinformation.
Dr. Senabi?
Thank you very much. I really want to emphasize this issue of trusting the people who are professionals. Our constitution provides for certain professions to be regulated. And the medical profession, the scientific professions of various kinds, there are different professional councils to make sure that society is guided and that the professions are also held accountable where there is harm that may be caused to society. So I think it would be important in this debate of COVID and vaccination that we are going to listen to those people that have been declared to be professionals. In other words, they can be trusted with the lives and the livelihoods of society. The second thing I want to say is that is the issues of religion and faith. That religion and faith, particularly the Christian faith, are not necessarily opposed to medical and Western medicine as we are practicing it, like myself and Dr. Nyati. We have had a lot of missionaries. We have had a lot of doctors who are of faith themselves, who have been able to be led by science. So there is no contradiction between being a Christian and being also believing in the scientific worldview. And so I want to lastly say that it is important that all of us go and register at the different phases of the vaccination program, so that then we can be able to benefit from immunity ourselves. Our families can benefit from us being immune, and the community as a whole can benefit, so that we can be able to live a livelihood that is productive as a community. Especially to protect those who are most vulnerable, our grandmothers who have hypertension and diabetes. If you are a young person and you are living with your grandmother and you do not go for that vaccination, you are actually putting that grandmother at risk. You should actually be taking the grandmother to make sure that we go to the clinic together, we get vaccinated, as and when government says we should be able to be vaccinated. It is very important that we honor life so that we can be able to be a productive and successful community. Thank you.
Now, it's 7 o'clock exactly, and we know for the fact that I was taking this part just for radio for 30 minutes, and I think I'll be handing over to the Speaker of Council. As from the radio side, I would like to thank you very much for the contribution. And someone just sent something to say, this is not a debate at all, it's not balanced. And I'm asking myself for it. The point that we're taking as radio was just to welcome the initiative, and the debate continues. Others will join online. But from our side, Dr. Sipho Senabe, Rebona Jalo, Professor Morala, Rebona Khape, Dr. Nyati, Rebela Khape, Lene, from the religious side, Lene Abel Mahachi. Thank you so much from our side. You guys will continue with the debate out there. We'll look at all matters. I mean, you can start doing the robust debates now from academics, from religious people, from the speaker side. Thank you so much, and it has been wonderful. Thank you.
Thank you very much, Tate Hans. FM. We as we thank you as you are leaving, I want to remind our viewers and listeners that we are continuing up until 7:30. So debate next time we'll have more time. I want us to continue with the debate, especially on the conspiracy theory.
The discussion, Monday to Thursday, 6 to 8 p.m. with Colin Hans. The discussion, Monday to Thursday, 6 to...
Okay, and Tate Hans. Okay, thank you very much. Conspiracy theory is not just only from, just ordinary people. I think the question here, knowledge is very important. For knowledge is power. We have heard, it was alleged as well, one of the councillors in one of the provinces was part of instigating and talking about this conspiracy theory of 5G, in such that we've heard that even the tower was burnt down. I want to go back to Professor Marwala, just in a layman's language, to simplify 5G. I know you have said that it is an electromagnetic wave, but just at a low level, 5G and the relation of 5G with COVID-19. Just, I know you've explained it, but if you can simplify it, because I think it is a serious conspiracy theory where even the tower was burnt down. So we need to educate our people more about 5G. If you can just take us through what is it, and then after that we'll hear from our viewers. Sipho will take us through the comments from our viewers. Then we'll also take the debate from there. Gidumedise Mamu Winingwenya. I see one of our parliamentarians is here. Our MP Mamngwenya. Thank you very much. Sikhuluma conspiracy theory here. E5G vis-a-vis the COVID-19 and the importance of vaccinator. Professor Marwala.
Thanks very much, Speaker, for inviting me.
No, thank you very much. Also welcome our member, our leader, Honorable Ngwenya. So yeah, it was really unfortunate that a councillor from KwaZulu-Natal actually treated that we need to take action against this disease that has entered. It is not COVID. We get it from 5G towers. It was quite unfortunate. And why do we have statements like this? I think part of the reason is because maybe as leaders, we are not studying science enough. Science and technology are all around us. That is the defining feature of our time. That is how we communicate. That is how we do almost everything using technology today. So it is important that our leaders actually equip themselves with the knowledge to be able to deal with scientific matters. Now, what are the issues that are in front of us? We have 5G. It's called 5G because it is the 5th generation telecommunication technology. We had the 1st generation. So the first phones that we had, which were 1G phones, were using voice to communicate. And the first one, if you even go back, they were not even digital communication devices. Walkie-talkie is not a digital communication device. It's a 1G technology. It was using analog. Analog means you are not communicating with ones and zeros, whereas digital means everything is translated into ones and zeros. The device, whether it is a phone, only sees ones and zeros and translates it back to. So 1G was basically only voice. Then we came to 2G, SMS. Please call me. Please call me is an example of a technology that came out of 2G when we were able to send SMSs. Then 3G, now we could be able to see videos in our devices. It was very difficult on that Nokia, if you still remember the Nokia, to see a video. It had no video capabilities. And now we are using what is called 4G or LTE, and what it does now, we can be able to download movies on our devices, but it takes a long time. It takes as much as hours to download a movie. Now with 5Gs, you are going to be able to download a movie in a matter of seconds. 6 seconds, you'll have downloaded the entire movie. It's very, very fast. It is fast because many of the transmitters are now closer to us. So you have transmitters that are almost like telephone poles. You still remember the telephone poles that we see in our streets? So they will have 5G towers. Now, 4G, it can be done with one tower that services a larger area. Because these towers are closer to us, there's been all sorts of conspiracy against them. Some conspiracies say that these towers actually cause cancer. Now, I have to put it up front that the electromagnetic waves of 5G are non-ionizing. Ionizing radiation is what you get from nuclear technology. And that is why even the doc here will testify, we are told that we should not expose ourselves to technologies such as X-rays over extended period of time, because those are ionizing radiation. 5G electromagnetic waves are non-ionizing, which means we must actually be, we are relatively safe from this. Thank you.
Thank you very much, Prof. Maybe before we take other panelists, let's hear what our viewers are saying. Let's take questions from our viewers. And let me remind the viewers that this is not a debate, it's a discussion. So we are discussing, we are empowering the citizens and empowering ourselves. Thank you very much. Sipho, over to you.
Thank you very much, Speaker. I just wanted to really emphasize on the fact that vaccines are there to ensure that we have immunity at an individual level. So when you get the vaccine, it is injected into your body so that you can be able to have the necessary antibodies that you get like you would get if you had an infection. But we don't want these antibodies to come because of the true infection. We want these antibodies to be there because you have been given the vaccine. So that when the virus comes in, it finds you already have those antibodies that can be able to help your body to can be able to fight the virus. That is what we want to do. And we do know that when you are infected with this virus, you do get this so-called immunity, but it is not long lasting. After 3 months, you can still be reinfected, like our professors have said and the scientists have said. So we want to have this vaccine so that we can be able to have a longer immune status among our people. That is the benefit that is there. Because if you are longer, for a long time immune, then you can be able to go back to work. Then you can be able to interact and trade and do all the other things that you need to do. The second thing is that vaccines are not harmful. So in other words, on one side, we get the good or the benefit of the vaccines. The second thing is they are generally not harmful. That's why we have regulators who can be able to check whether this is harmful or is not harmful, this medication. And they have been checked. And even the ones that we got from India, they are being checked by our regulators so that they should not harm the people. And so government has put in place these regulators so that they are there to protect you as the members of the community. Government has also made sure that you have a health system that we would want to ensure that it is accessible to all our people. Unfortunately, the quality of the services that people are getting, the access is not that optimal, so much that in our townships, most of the people who have diabetes, who have hypertension that is not controlled, are in the townships and in previously disadvantaged communities. We want those people who are so vulnerable to be among the first people to be vaccinated so that they should not die with the combination of COVID and hypertension that is not controlled. And so we are asking you, if you know somebody who is diabetic or who is hypertensive in Makelwane, when they say phase 2, please help us to bring Makelwane to and encourage Makelwane to come to the clinic or to the work to the hospital where that person is going to be vaccinated. Then Tina Banye, who are not having diabetes and hypertension, when all the vulnerable people have been vaccinated, then we can come so that we can all have herd immunity. I just thought I need to emphasize this one of the very vulnerable people, Okoko, Omkulu, who have hypertension in high. Those are the ones we want to come early so that we can be able to protect them very quickly. And there will be a time when we will be able to register So please listen to radio stations about how we are going to be able to register the MECs, the government officials will be communicating through our radio stations. There is a beautiful communication program that is coming from Gauteng through our communicators. Then we will be able to be guided from time to time. So that by the 10th, when the vaccines come to our province, we are ready to vaccinate our nurses and our doctors. And then they will be followed by those who are very sick, who have hypertension, diabetes, and other conditions. And then they will be followed by the whole community. We are appealing to you to please cooperate with us as the government so that we can be able to vaccinate our people. Thank you.
Thank you very much, Dr. Sinabe. I have realized we have two SIPOs on the program who are very active. So may I be allowed to refer to you as Dr. Sinabe, and then I refer to our SIPO as SIPO, so that there's no confusion about the SIPOs on the platform today. Thank you very much. Thank you very much for that information. It was very useful. May I request SIPO Masiho to just take us through what our viewers are saying. I see messages are coming in numbers, Dr. Nyati, and they are very, very important inputs and questions so that we can try to answer some questions. Over to you, Mr. Masiho. Sipo, are you there? Okay. While Sipo is trying to connect, I can see some of the inputs and questions on the chat box here. Dr. Nyati, maybe if we can just check where Sipo is. There's other one from Queen Nomasonto Wealth. She says, may the God we serve show your true colors, and may your punishment come very soon for misleading God's children. I think she's referring to the conspiracies that we are talking about. Indeed, God's children die for the lack of knowledge and your greed and personal agendas. And then the other one from AB Muleko. This panel is not balanced at all. I think this is what Date Hans was talking about. No debate at all. These panelists are just singing from the same hymn book. So I, for one, can't trust what they say. I think that we need to disseminate more information here. And then Noni says, may I request that for the next session, if there would be any, kindly invite traditional healers as well. Indeed. And then the other one says, please elaborate on the difference between the 4G and 5G spectrum. I think that person is referring to transmission. Remember, COVID-19 is airborne. The doctors are here. I think they will explain that. The other one from Easy Khaumputse iPad says, Madam Speaker, our biggest enemy here is those with access to keyboard. It's those who deliberately choose to spread fake news and conspiracy theory unprovoked. What does it say? Unprovoked. Okay. Okay, yeah, unprovoked. Okay, now to mitigate against this, we need to intensify our efforts to bring to book the culprits. Up until there's consequence management, we shall forever experience these malicious acts of misinformation and the deliberate spread of fake news. I think that's what Dr. Nyati was talking about. The other one from our Honorable Winnie Ngwenya. Thanks, Speaker, for inviting me to this discussion. This is very important for me. I have learned a lot in terms of the 5Gs and the explanation about the vaccine, how it's going to help us. Okay, the other one, I think it's the last one. It says, Madam Speaker, Oh no, there are many messages coming in. Is Sipho back? Sipho, are you back?
We are still struggling to get hold of him, but Nhlaga is trying to get hold of him.
All right, let me
All right.
maybe two. Okay, okay.
Can I just maybe take the question so I don't waste time? There's a question here. Can the panelists describe the mRNA technology and where it might have any side effects? Now, I won't spend a lot of time. All I can say is that vaccination has been there for almost 100 years now, and we've been using, when I say we, as the medical scientific world, have been using technologies whereby either the germ that is causing the infection is weakened and then given as part of the injection so that your body will react to that germ, so that when the real germ comes in, you already have a defense against that weakened, you've got defense against that germ from the weakened germ. Some of the vaccines, we were using technology whereby the germ is killed, but your body does not know that this germ has been killed. So when the real germ comes in, then the body will fight with that. Now there is new technology, and mRNA technology has been there now for almost a decade. All right, but it's the first time that it is used, on a vaccine in the way that it is being used here. Two vaccines, the one from Moderna and the one from Pfizer, are using this technology. Basically, they take an RNA that is part of what they call spike protein of the virus, the SARS-CoV-2 virus, and that RNA, they work on that, and what it does, once it's injected into the body, it then goes in and teaches your cells, to produce a spike protein, but it never gets to the nucleus where the DNA is. So once it has taught your cells, to produce a spike protein, then it is destroyed without going into your nucleus. And so then the body will develop immunity against that spike protein that has been produced. When the real germ comes in, then the body is ready to fight. So, and two of the vaccines that have used this technology, the Moderna and the Pfizer one, have got about 95% effectiveness. That is the mRNA technology, and there are no real major side effects. Yes, pain on the injection site, a little bit of headache, a little bit of raise in body temperature, but there hasn't been any major side effects. Obviously, it's also important for people with a history of allergies to actually, declare that, because any vaccine, any tablet that you take, there's always a possibility that your body may react, which is why for 15 minutes after getting the injection, you are observed by whoever is giving the injection so that there is no allergic reaction or something called anaphylactic shock, which would require immediate injection to try and reverse that situation. So I hope I've answered the question. Thank you.
Thank you very much, Doc. Thank you very much. You have indeed answered the question. Let's take Sipho. I see Sipho is back now. Sipho, please take us what our online viewers are saying.
Thank you very much, Madam Speaker, and I apologize earlier on. And also, Madam, just to thank Josie FM, who have just alerted me that the callers have been raving about this conversation, and they would like to extend the conversation for an hour next week. So we are doing an exceptional job in educating and informing our people. So Raleboha to Josie FM. There are so many comments, Madam. I'm going to try to go through all of them. The first one comes from Christopher, who says, please don't say these conspiracy theories are not true. What is the actual goal for these vaccinations? Why is it be tested here in Africa than Europe, where a lot of people died? Why has Africa become the scapegoat all the time? The next one from Ivy Kumalo says, good evening. Can I get clarity on this vaccine? Is it the same as the flu vaccine or what? Like myself, I'm COVID-19 survivor. So will it be good for me to take. The next one from Jabulani Baloy says, hopefully we would have established the efficacy of the vaccine that arrived in Mzansi through the rollout to frontliners. He then goes on to say, when exactly did the Minister of Communication sign off the spectrum for telecommunications companies to provide this service? Noktula Chabalala says, good evening, leaders. Thank you to our president for the vaccine and to India for being thoughtful of humankind. Itumeleng Shinwai says, Dr. Nyati, you are right. In terms of educating our people, those that don't use smartphones and those who can't read. Madam, there are too many conversations here taking place on social media, but people are appreciating the conversations that we are having today. So let me stop there for now, madam. I'll take another round later on when we have the time. Thank you very much.
Okay. Thank you very much. Yeah,
Speaker?
Dr. Nyati. Yes,
Can I suggest that there's the last question around spectrum and the minister? Maybe Prof. Marwala can just quickly talk about the spectrum allocation and the delay there and everything.
No, absolutely. I mean, South
Maybe
Africa
before Prof, I just want to read one. I think it's linked to the one that you are about to answer. There's one question here that says, Madam Speaker, we also do our research. And now if you can Google, Dr. Johan Dennis makes it clear that this vaccine has a nanoparticles stroke nanotechnology. As you respond, maybe you can touch on that as well. Thank you.
It says this vaccine has what?
Nanoparticles. Nanoparticles.
Okay. No. Thank you very much. I mean, on spectrum, we have not issued spectrum for the last 15 years. So that is a cause of concern. Obviously, last year during the pandemic, there was an emergency spectrum that was issued so that we can be able to ramp up online connectivity. So last year, the minister sends, the guidelines that are going to be followed in the allocation of spectrum to an organization called ICASA, which is the one that manages this, So now what happened there is that whole process is being challenged by Telkom, which will result in the delay of the allocation of spectrum. In South Africa, things have to be done fairly, and I think the courts are going to adjudicate as to whether there is a merit of that challenge or not. But otherwise, if in the absence of that challenge, we are ready to allocate spectrum. On the issue of nanoparticles and the vaccine, I must confess, I am not sure whether this is a nanoparticle-induced vaccine, and I will leave it to the doctors.
Okay, all right. So maybe let me just follow up on Prof on this thing. I think people. That question is clearly one of those questions that are coming from the videos that are circulating, that are clearly conspiracy videos. Now, I think people need to understand, when we talk of a vaccine, we talk of a biological preparation that is given to a human being for the human being to build artificial immunity. Now, for that vaccine to be given to human beings, it's first tested at the lab, what we call in vitro tests. And once it has passed at the lab, to prevent an infection, then it goes to human trials. Phase 1, looking for safety in a small group of people. Phase 2, safety and effectiveness or efficacy in a small group of people. Phase 3, safety and efficacy in a large number, thousands of people. Now, each time there's a move from one stage to the other, even before the study is done, you get ethical approval where you must declare exactly what is going to be inside that vaccine. So there is no ethical approval that can be given by any, a body worldwide where a biological preparation will have, nanoparticles or a chip or whatever. So I think people, this is again, talk about using Google as a source of information. Google can never be a true source of information for everything. In this instance, there is no vaccine. Of the vaccines that have been approved, the first two, they use mRNA technology and nothing more. And then the others are using what we call an adenovirus, almost like a cold virus that has, been used to carry the virus, part of the virus of the COVID-19. So there is no vaccine with nanoparticles. There is no vaccine with, chips. So that is part of what we're here to demystify, to say that's part of conspiracy theories. So I'm not sure who this doctor is that they're quoting, but that person is spreading what we call disinformation with intentions to make people not to have confidence in vaccines.
Thank you very much. Thank you very much, Doc. I just want to remind our viewers that we are creating this platform for information sharing, and we are inviting experts. So we are listening to the doctors here. Maybe let me hear Dr. Sanabe. Do you want to talk about the video from the doctor that has been circulating? I know Dr. Nyati has also given us some information and some light on it. Thank you.
I just want to
real information.
I just want to commend Professor Marwala here, who has demonstrated a very important a cardinal principle of leaders in the scientific community. Not everybody who calls himself a doctor or an expert is an expert in that area. So the claims of the doctor must be matched by whether that doctor is registered with a council, whether that doctor is a medical doctor, whether that doctor is a scientist. Professor Marwala was very humble to say, this is not, in my field. I would rather refer to the right people. Now, I think for our people, if you are in doubt, then go to a registered health professional to be able to give you authentic information. If you are in doubt, then you can go to any of our regulated bodies that are there to protect you as the community so that you may not be misguided. Our government has collected a whole set of scientists that the government puts on our televisions from time to time. Those are the people we will want to encourage you to listen to, because they are scientists and they are not just practitioners. And so I think it is very important to say not everything that is on Google is the truth. The truth is also embodied in our indigenous knowledge systems. And so it is not necessarily important that you should have a PhD to be able to have knowledge that is beneficial to our people. And so I think it is important to understand that we will need to be skeptical, we need to be robust, we must be able to debate issues like we are doing today. But not every doctor or any person who thinks or says that he is a doctor is actually having the authentic information. And that's why we need to be able to look at our regulators and those who are supposed to guide us in society. Thank you.
Thank you very much, Doc. I'm not sure how much time do we have, but I see there are two hands.
I think take them.
Take the hands, okay. But I think the message here, Bahlali, is that massively information from the right sources, from people who have the know-how, who are experts. Singahambe sithathe umgosi ozasiconfuse as the citizens. I have Amos, and then after Amos, graciously favored Lady T. Amos, just briefly, your question, Amos, or your comment? unmute her, Dr. Amos, and speak. Can we unmute him, maybe? Yeah, okay.
Yeah.
You may speak now, Amos. Okay, one mute her. No.
Okay. Whilst
Okay,
Amos, yeah, Gracious a favorite? Because Amos has disappeared now. Amos, Gracious a favorite?
I think from my view, people are worried and alarmed regarding the rollout of the 5G transmission and switching primarily because it happened during lockdown. And I did a bit of research regarding it, the spectrum, because I'm from the mobile space. So remember, we upselling the technology in terms of what's gonna benefit us in the long run. However, we're not talking about the ripple effect. Transmission of 5G, it means that everything is fast. The speed, meaning it's fast, it's expensive, it's technology, blah, blah, blah. So, however, going back to the vaccine, I don't see the correlation between the two. However, I think people are worried because of the way the whole process was done. Remember, there was no tender, there was no bidding. It was just an emergency spectrum that was issued to MTN. And it happened during lockdown. I think that's why people are alarmed. So that's one. The way the whole process was done, it did not follow the right process. It was not the spectrum, there was no bidding, there was no tender, it was just an emergency thing. So that's why people are asking themselves, why was it rolled out as during lockdown? Because it's not an essential service. So we're asking ourselves about the emergency. What is the emergency? Because the 5G tower, it's expensive. To upgrade a tower from 4G to 5G, it's quite expensive. And if you look at the rural areas, it's gonna take time for people to get access to 5G. People are even discarding that it's expensive, because remember what we're saying it's we're going to get access to this fast, we're going to access to this fast. However, it comes at a price, it comes at a cost. Are people going to afford it? And when it comes to going back to the vaccine has nanoparticles. So whether it changes genetics or it doesn't, I'm not sure about that. However, I did the research and I dug deep because I'm into health as well. So, but my question to you, Minister, is I understand that once people have injected with the vaccine, for some reason, they say it reaches end of life in your system, and I'm not sure whether it's a conspiracy theory or it's just, however, they're saying that you have to inject is it quarterly or yearly in order for the lifespan of the vaccine to be activated.
All right. Speaker?
Yeah, thank you very much. Can we be short in our inputs?
Yeah, I think people are making comments instead of asking questions. But
yes,
I think we need to. Sorry, Speaker. The previous speaker is exactly doing what we are trying to correct here. She says she's done research, but I mean, what research is she talking about? There's nothing about nanoparticles and vaccines. Clearly, she has done Google research, But here we're talking about proper scientific research as far as vaccine is concerned. So please, I think let's also be wary of people who are using this platform to further enhance, disinformation.
Okay, thank you very much. I had noted Amos. Amos, are you back? Then we'll have the very last hand, which is from Sandile Mahlaba. Will be the last, and then I will give the last bite to the panelists to respond and close off. Amos, are you back on the platform? Unmute. Can we unmute Amos, Doc? Try and unmute. Yes, you are unmuted. You may speak now. Okay, it sounds like Amos is struggling. Mr. Mahlaba.
Yes, Sanibona Speaker. Thank you very much for the opportunity and for a very good speakers that you've got today. I think for me, one of the questions that I have is just maybe looking at the opportunity, how we can all partner, government, private sector, civic organization, to educate, to advocate for the correct information. Because I think for me, what I'm hearing today, what I've been seeing in these conversations, there is really a very big lack of basic information. And I think for me, kuma speakers on corner and my presenters, is just looking at direction of saying, how do we partner, how do we collaborate to make sure that we start perpetuating out there the correct information and the positive information towards the development of technology and again, the fight against this COVID that has been killing so many people of our families. Thank you very much.
Thank you very much. Thank you very much, Doc. I think Amos is struggling to speak. Maybe I will hand over to our panelists. Yeah. Professor Marwala, let me start with you maybe. There was a question that was asked, why rush from abrupt rush from 4G to 5G?
No, I don't think there is a rush. These technologies have been going on, and I'm sure after 5G you're going to get 6G. I think the pace of development, I don't know, I don't agree that there's been a rush in this regard. Maybe just to summarize that, thank you very much, Madam Speaker, for this engagement. It is very important just to emphasize what Dr. Nyati has actually said. Going to Google is not research. Going to Google is not research, and much of the information that you are probably viewing on Google is not based on peer-reviewed conclusions. So these are conclusions that have not been looked by peers, and this is actually quite dangerous. I mean, it's the same thing that I'm sure Dr. Nyati will say, that if you are sick, you can't go to Google to try to cure yourself. You have to go and see a doctor, because people have to go and study these things for a very, very long time. There's no shortcut. So thank you very much, Madam Speaker, and I look forward to working with your office in the future.
Thank you very much, Professor. Maybe before the other panelists respond, we have been given time up until 8. Maybe for 5 minutes, Sipho, if you can just read more comments from our viewers. I hope Amos has written down what he wanted to say because he was unable to articulate it because of technology, I guess. Sipho Masiho?
Yes, madam. Thank you very much. Thank you very much to our panelists once again. The comments are flowing. The first one that came in says, "Thank you, Madam Speaker. I am with young people here, and they would like to ask Mr. Marwala to explain further on the conspiracy about Bill Gates, as he touched his name a bit. Bill Gates involved in this matter of vaccination, particularly as they say, they have been hearing that he is involved in funding the vaccine throughout the world. And what is it that is said about him seemed true on social media, that he wants to manage the world population and particularly Africans. That's the first one. The second one is this information is all over the media. Can this informative sessions be done in such a way that the community members can also benefit? It's just a request. There was another comment here where I saw somebody was asking about Ivectamin. Apparently this Ivectamin is also doing some rounds about people having taken it. And can the doctor please respond and tell us whether this drug is safe for people to take? Thank you very much, Madam Speaker.
Thank you very much, Mr. Masejo. Maybe before the doctors, let's go back to Professor. Prof,
thank you very much.
Conspiracy about Bill Gates.
I wouldn't want to entertain the conspiracies about Bill Gates. To the best of my knowledge, the vaccines that we are using were not manufactured by any of Bill Gates' companies. We know Oxford University has been involved in the establishment of some of the vaccines. So I think those are conspiracies that we should discourage people from even pursuing, because they serve no purpose other than to derail us in dealing with this pandemic. The most important issues is that there are guidelines on how to avoid, to minimize the risk of transmission. Let us adhere to that. There are vaccines that have come to the country. Let us register on platforms where we can register. I registered on the Department of Health app where you register so that you can be on the queue for these vaccines. So let's do all these things rather than be worried about conspiracies that are on Google. Thanks.
Unmute speaker.
Thank you very much, Prof. Let me now hand over to the doctors. Dr. Nyati.
All right. I think just back to this thing about the technologies that are embedded on vaccines, the allegation. I think people need to understand that when these ethical bodies approve these studies, whether it's in the lab or in human beings, they will never approve something that is going to cause harm on a human being. All right. So I think people need to now just put that aside. Number two, this 5G story. There is an organization called ITA globally, which is part of the United Nations. And that's the body, that, looks at these issues of spectrums and stuff. But there's also another body that looks at the use of these non-ionizing, electromagnetic waves and the potential to cause harm on human beings. So there is no technology of, mobile communication that is used without being reviewed, in terms of potential to cause harm when people use those cell phones. So I think and there are guidelines that they've put in place so that you use that technology within those guidelines. Therefore, your chances of getting any problems are managed. So I think let's put that to side, right? The last thing here would be for me the efficacy of the COVID shield. Well, somebody asked that question. Efficacy of the vaccines that landed 2 days ago from AstraZeneca, made in India. 70% effective. All right, 70% effective. They've gone through all the, phase 1, phase 2, phase 3 studies, 2 doses about a month apart, 70% effective. All right. So I think people have got no reason to worry. There's more benefit than any harm. And if there's anything, it's mild headache, you know, a bit of flu-like symptoms and pain where you are injected, nothing more. Ability of South Africa to produce vaccines. South Africa has the ability to produce vaccines as evidenced by the fact that our own company in South Africa, Aspen Pharmacare, is actually sub-licensed to produce vaccines for Johnson & Johnson in Port Elizabeth. And they will be giving us, those vaccines as a country in the second quarter of this year. So we have the ability to produce. What we don't have, only because of funding, is the monies to invest in the research and development of vaccines. We need as a country to invest in R&D, not only in healthcare, in agriculture, in telecoms, and in other areas. Our leadership, I'm sorry to say that, Speaker, but general, our leadership within the country, in the regions, and even in the AU need to prioritize, investment in science and scientific research and innovation so that our highly skilled people in the continent stop being collaborators in other people's, research, but actually are involved in doing research in Africa to solve our problems. And they can't do that if we do not fund them. So it's a big challenge on the AU regional bodies and our countries to enable. We can produce, we've got the brains in the country, but without the money backing, there will be no solution. Africa is a scapegoat, that's what they are saying, of the Europe and West. Well, as at today, 104 million people worldwide have been vaccinated. The majority of the people vaccinated are in America, followed by Europe, and then other parts, South America and other parts. So if this thing was a conspiracy against Africans, they would have started by, vaccinating South Africans or Africans. So the fact that the majority, in fact, there's only one country in Africa that has vaccinated, starting last Saturday, which is Algeria. South Africa has not even started vaccinating. So if this thing was about wiping out Africans, then they would not have started in America and all these other parts of Middle East and Europe. So that is, something that people need to be able to understand. Flu vaccine and COVID-19 vaccine, they are not on the same WhatsApp group. They deal with different germs. Flu vaccine is for an influenza virus, which is a mix of virus, totally different from the SARS-CoV-2 virus of COVID-19, which is a coronavirus. There is nothing in between. Somebody said taking vaccine yearly. I don't know where they get that information from, because at this moment, we don't know how long the immunity is going to be, depending on how quickly this virus changes itself. So I thought I needed to just quickly tackle those questions. Thank you.
Thank you very much, Dr. Nyati. Thank you very much. Let's hear from Dr. Sinabe.
Thank you very much, Speaker. I just want to emphasize the issue and the principle of us being led by science. There was a question about ivermectin, which is one of the drugs that have been alleged to be effective in terms of treating the vaccine, the coronavirus infection. Ivermectin is an antiparasitic drug. In other words, it acts against parasites. It has not been proven to be completely efficacious in terms of dealing with viruses. And we think that there is some element of truth that it can be effective in treating the virus, viral infection, but it is still being investigated through what is called clinical trials. In other words, these are experiments where we want to be effective. We want to be sure that this drug can be able to work against the coronavirus. There is a regulator called the SAPRA that is overseeing the clinical trials, these experiments, so that we can be for sure that it is actually working. At the moment, it is licensed for those doctors who are saying, well, I am going to take a chance and I will be responsible for whatever side effects if I give this person this medication. So we are still waiting for those clinical trials. And then again, the issue of this efficacy, as Dr. Nyati has said, that these vaccines are efficacious. In other words, they can help the individual not to get the infection again. But we want not just one individual, we want 67% of us. We must go and be vaccinated. If it is only one of us or two of us, it won't work. So we must mobilize our communities, everybody, everywhere, so that we can be able to actually encourage and have that 67% to have the population immunity and herd immunity. The last thing I wanted to say about young people, because young people raise the issue about Bill Gates, and I'm sure Professor Marola will agree that it is very important that we encourage our young people to study the sciences, the technology, engineering, and mathematics subjects, so that we don't follow just what is on Twitter or on social media, but that we are actually going to grow our own generation of scientists and people who can be able to be literate in science. And I think this debate going forward is going to be led by those scientists. And I'm encouraging you, next time that there is on television, these big scientists that Minister Mkiza is collecting, the big professors who are on, please listen to these professors. Let it be that we will be guided by that science, so that we can be able to differentiate between the misinformation or what is called an infodemic, where there is misuse of information to actually mislead people, not based on science. We don't want an infodemic. We want a program that is going to be vaccinating our people so that there is herd immunity, so that there is population immunity. Thank you.
Thank you very much. Thank you very much for those last remarks, Dr. Sinabe. Let's hear from our pastor, Pastor Abel, yes, your closing remarks, and maybe try to respond to some of the question, if you may.
Thank you, my speaker. I think from the religious side, I think it's important and fundamental in terms of educating, in terms of reactivating the communities, because if you are going to roll out the vaccine, it's important that the religious leaders are on the forefront. And they are leading the communities towards the vaccination in that regard. So I think it's important that we educate. Let's see how we can go about mobilize. Number one, mobilizing the sector. Two, through the religious sector, we educate. After educating, we roll out the necessary information through booklets that talk about vaccinations, the importance of vaccinations, like we did when we were educating communities about coronavirus, sanitizing of hands, wearing of masks. I think that information is very pivotal if we are going to demystify those particular theories. And also, I want to also encourage religious leaders as well, especially in the Christian fraternity, that it is important that we come together. Let's dialogue. Let's engage on these issues like they did back then in the days of the apostles, when there was a dispute of misinterpretation of scriptures, or there was a misinformation concerning issues of scriptures. They came together and spoke together and dialogued. And through dialogue, they came to a way forward to see how they can find ways of emancipating the communities. So I'm calling upon these leaders, let's come together. Let's work together with government. Let's work together with various institutions to see how we can pull our communities together. Together, we can do more. It's not time for us to be divided. It's time for us to unite together and fight COVID-19 and work together for the sake of South Africa. As I conclude, Nkosi Sikelel Africa, may God bless South Africa, and may God bless our speaker, and may God bless the city of Johannesburg. Thank you.
Amen.
Amen. Amen. Let's hear, in closing, let us hear from our Member of Parliament, Honorable Ngwenya. Can a word from you, Ma?
Thank you very much, Honorable.
Discussion.
Thank you very much, Honorable Speaker. NgesiZulu bathi ufunda akhulelwa. I've learned a lot about this program that we have done today. And I wish that you can continue to do it, seeing that our community also, they must learn. Because what is outside there is what people that they just hear about other people, putting the fear to the people. So I'm happy because the pastor have touched the faith. Then we need to go out and assist our community to have faith on what the government have done. We're crying to say, ikhambi lizovelaphi na? Our people, they were dying day and every day. You speak to me today, tomorrow I'm no more. You speak to another one, uyalala futhi akasekho. So nali ikhambi lifikile. Our responsibility now is to pray to God to say, nali ikhambi lifikile nkulunkulu wami, help us to use this ikhambi sizokwazi ukusave impilo zabantu and futhi nabantu nabo bakwazi ukuthi baphile. I'd like to thank all the panels odokotela bakhona la that ngifundile okuningi nami as a public servant. When I speak with the people, I know what to say. I know how to advise them. Ukuthi nali ikhambi selifikile and elifuna abantu abanjani. It's better, Madam Speaker, because I'm also part of those people who are vulnerable, who've got high blood, who've got sugar. I did learn today, what must I do? Njengomuntu onoshukela, njengomuntu futhi on a high blood. Then I'll able to educate other women that are like me and the community in the constituency where I'm deployed to say, Nai ifikile, this is what you do. Uyabodokotela hlukana nokugugula izinto ezizokutshela manga nabo bodokotela bakufundele lokho abangama professional. Hamba uye clinic uzokwazi ukuthola uncedo. Ngicela Madam Speaker, continue with this program. This is the beginning, but I believe that there are a lot of people that are listening to this. This 67% of the people, I think we need to have 100% of people to have faith for us to be healed in South Africa. Thank you, Madam Speaker.
Thank you very much. Thank you very much, Honorable Ngwenya. Thank you for your input. I think Umama Ngwenya uyatsho ukuthi nayo vaccine seyikhona and we are hoping ukuthi very soon nekhambi lizofika. But okwamanje i-vaccine ikhona. We are not forced, as we have heard from our leaders, from the minister and from the president, that you are not forced to vaccinate, but it is important that we vaccinate. Hence, we have these sessions. So we must be well informed, because it will also not be assisting if vaccine ifike and then people don't vaccinate. So we are encouraging people, not forcing people to vaccinate. Sigome sasibiza ngokuthi umgomo safunda sifake igrivizo esikolweni. I still have marks, like I said, engalweni where we besigonywa for izifo. So this is the same that is going to happen now. Siyagoma against this disease esihlasele eseyithathe abantu abaningi. Without a waste of time, I think Mr. Mahlaba spoke about the importance of collaboration, partnership. We really call upon all members of the society, as we have our experts, we calling from people, let us partner, please partner with us as the city of Johannesburg as we embark on this civic education. But knowledge is power. So we are imparting knowledge to our people. Civic education is at the center of us as the city of Johannesburg legislature. We are saying, let us come together and fight this virus as a society and stop the infection, stop the spread of the virus. We want to thank our communities. We want to thank our panelists. And we also want to thank, in fact, communities, those that are in the meeting, those who have raised their voices and have spoken. Thank you very much. We thank our communities online. Thank you very much. We want to thank our Honorable Member of Parliament. Thank you, Ma, for gracing this discussion and also your input. Very important as our leader. And I know that when you go back to your portfolio committee and you go back to, you will say, no, civic education is happening in Johannesburg. Thank you very much. Thank you very much, all our doctors present. Professor, thank you very much. Let us collaborate. Collaboration is very important, but most importantly, for the first time ever, we have now collaborated with our local media. You know how great it is. We have comments from Jozi FM listeners. We are also going to be streaming up until 9 p.m. tonight from Eldos FM. And we are calling upon all other local media houses to join hands with us as we educate our communities, as we empower our communities, because this is about empowerment. Thank you very much. I am also very empowered. As a public representative, I'm very empowered. Really, thank you very much. Thank you, Ningatino Nangomso. What has come across here, Dr. Nyati, is that time allocated for this discussion is very short. Yes, I'm reading here, they are saying time allocated is very short. There's request for a repeat or a continuation of this discussion. There is a request from our viewers. There's also a request of bringing on board traditional practitioners, a representative. So we have noted those requests. We will discuss with the team, people who are behind preparing for these sessions, which includes Dr. Nyati and the team. Thank you very much to your team, Dr. Nyati, Abonwabi Satlama, and all your technical team. And thank you very much to the team from the Office of the Speaker. All of you, I won't mention you by names, but all of you, thank you very much for making this discussion so fruitful. Enkosi siyabulela sibambana sibini. We've come to the end of this session. Thank you very much.
Thank you.
Thank you. Thank you, Speaker. Thank you very much.
Well done, Madam Speaker. Well done, team. Good night.
Thank you. Thank you very
Thank
much.
you so much. Good work.
Well done. Thank you, Madam Speaker.
Thank you, Madam
panelists.
Speaker, and the team and the panelists.
Thank you,
very
Madam
much.
Speaker. Much appreciated.
Thank you.
Thank you, Madam Speaker. Much appreciated. Bye.
Bye. Thank you.
Thank you.
Bye. Great job, Madam.
Thank you,
very
Madam
much.
Speaker. We appreciate so a lot.
Thank you very much.
Thank you,
Siyabulela, Mama.
Do it again.
Enkosi Mama Ngwenya, awusemhle?
Well done.
Siyabonga, Mama
Madam
Ngwenya.
Speaker, even West Rand is here.
Thank you, West
Siyabulela,
Rand.
Mama
I see Lucas
Ngwenya.
Moses. Siyabulela. Thank you very much. Siyabulela.
Siyabonga.
Siyabonga, mantombazana.
It's a monster.